Uh, our guest speaker for today is Lachelle Jones. Uh,
Hello.
Before I start say anything, we as Radiopia, we really like to thank you for that, for your willingness to share your
Mm-hmm.
vast knowledge in this webinar for everyone,
Mm-hmm.
not only for Ethiopians, but we have also guests from the Africa. So not only as
Mm-hmm.
Ethiopian, as African, I would really like to appreciate your commitment. Before we proceed,
Mm-hmm.
I want to say some intro about you. I would like to introduce you or some of the my colleagues here.
Mm-hmm. You want me to give a brief introduction?
I will try to give, then you will continue.
Okay, sure, sure.
Okay, Lashir Jones is a highly skilled ultrasound specialist in obstetrics and gynecology. She is a registered diagnostic medical sonographer, and also she is a registered diagnostic cardiac sonographer. She has a very vast experience in this field with more than 20 years of experience. Uh, she's very much into obstetrics and cardiography. I can be a witness for that also. She also have
Mm-hmm.
a YouTube channel where she uh, teaches fellow sonographers about this interesting echocardiography and obstetrics. She is
Mm-hmm.
also a dedicated professional in the field of diagnostic medical sonography, always striving to go above and beyond in her role. She has active involvement in projects such as INTLOS and also Inclusion Task Force. She also prepares some questions for registry review tutoring, and also I personally know that she also teaches some students. She gives some tutors also. Uh, she's very much into obstetrics and gynecology. She also
Mm-hmm.
have some webinars before this. Some of
Mm-hmm.
the webinars I myself were able to get the chance to see, and she's a marvelous speaker. I hope we all is going to enjoy that today, especially in cerebral view, cerebral tracheal view. Uh,
Mm-hmm.
she is also has multiple certifications and research. If I have to mention everything here, it's going to take a lot of our time. So I just want to proceed to her. Lachelle, thank you for
Yes.
volunteering to give us this
Mm-hmm.
wonderful opportunity. And we are
Mm-hmm.
all thrilled to have you here.
Yes. I'm so excited. So, so excited. You pretty much said everything. That was my whole resume there. You hit everything right on the nail.
It's
So
just a
thank
little
you
bit
for that
from the
introduction.
tip of the iceberg.
Mm-hmm. Mm-hmm. Yes, thank you for that introduction, and I'm glad to be a part. So I'm ready to get started. If you are, I can share my screen so you can see my presentation.
Of course, of course. Please do.
Okay, okay, let's try. So I'm going to share. Okay, I'm so excited. I was actually practicing a few of the slides before I joined you guys. So let me start at the beginning, actually. Are you able to see everything
Yeah,
on
we are
your
able to,
end?
of
Can you see my slides?
course.
Okay. All right. So let's get started. So what we're going to discuss today is some strategies to how to conquer the most detailed anatomy scan that the fetus will have in the entire pregnancy. So if you're like my office, we are on a time frame, and so we have to achieve all of these views within a certain time frame. So it's within 30 to 45 minutes. So I'm going to just go over a few tips on how we can accomplish that. Okay, before we get started with the tips, I just wanted to break down a few objectives that we'll be going over today. So we'll go over a complete understanding of the 20-week scan. We'll go over a standard protocol that you'll typically see. We'll talk about time management strategies. We'll talk about the measurements that are included and then some strategies for successful implementation of this, okay? So let's get started. So what is the preferred time frame for a 20-week scan? Most places start their level 2s at 18 weeks. At my office, we start our level 2s at 20 weeks, actually. So standard is usually between 18 through 22 weeks to achieve these views, okay? And then what is our purpose? What is our purpose doing the level 2? We're trying to detect if there's any fetal anomalies present. We want to do a proper growth assessment. We want to determine placenta anomalies and see if there is placenta previa. And then we want to check for cervical incompetence as well as umbilical cord anomalies. Okay, so we have to achieve all of these checklists here during iScan for the 20-week. Okay, so I hope you can see this. It's on the smaller scale, but this is an example of all the views that you have to take for standard level 2 protocol. Okay, so of course it includes all the brain structures, which we're going to go over this a little more in detail, as well as the face structures that you see present, neck, chest, heart, abdomen, the skeletal, so that's your spine views, arms, legs, and feet, and hands, placenta, umbilical cord, and then genitalia. Now we're going to touch on all of these in separate categories coming up, okay? So let's go next one here. So like we said already, the time given is usually between 30 through 60 minutes. At my office, they require us to be finished within 45 minutes to give the doctor time to see the patient afterwards. Give them about 15 minutes, so then you'll have a total hour. But of course, for some, it takes a little longer, and some are taking up to an hour, some even an hour and a half. So we want to decrease those times, but still get the adequate quality of our views. Okay, so let's get started. Now, our typical standard probe selection for our OB is usually the curvilinear probe. You see, we mentioned that here. Okay. Now, in some hospital settings, they use a linear probe. Now, the linear has a high frequency, but notice the depth of penetration for the linear probe, especially when you compare it to the curvilinear here below. So typically, the linear probe is usually used in the first trimester settings for that high frequency. Now, for our obese patients, we want to use a lower frequency. So this goes back to our physics lessons, right? So the lower frequency will give us the greater depth, which you can see in the demonstrations here. Okay, we achieve a greater depth with our lower frequency probe selection. Okay. All right, so let's talk about some tips that these are very effective tips for our obese patients, okay? Now, for our 20-week scans, we usually don't require a full bladder, but in cases where there is a high BMI, we will ask the patient to fill her bladder. And you see the difference that it makes with a full bladder. It pushes the fetus and the uterus upward, and it takes away the adipose tissue. You see the difference here. See? So it just brings the structures more superficial, which is what we're trying to achieve. You can also see that in our demonstration on the ultrasound side here. You see, you can almost make out a 4-chamber. You see that? So that's a technique to use in that setting. And another technique is to turn the patient on their side, whether it's the left or the right side. Okay, please see. Are you still there? We're still there? Okay, so I'll go back. Okay, so yeah, so if you turn the patient, whether it's on her left or right side, you see the difference of achieving that superficialness You see? So now we see that there is a nasal bone. It's hard to demonstrate that when she was in her supine position. So just turning the patient on her side, you're able to achieve this view as well as this one here. All right, so it really makes a big difference. These are effective tips to achieve these pictures on the obese patient. Okay, so this one here, this is the ideal position. When I put the probe down, starting my exam, and I see the baby in this position, I do a little dance in the inside because ideally we can see the profile, we can see baby's face, heart, we can achieve all of that in this ideal position. However, it's hard to see the post fossa of the brain as well as the spine because we rather see the spine when the spine is up. So, but ideally for your heart views and your face structures, this is the position that you'll like to see usually for the fetus. How about this one? Look at this here. Right away, when you see this, you're like, oh no, what in the world? How can I get any pictures when the baby's in this position? However, you can actually achieve a lot of your pictures, almost half of your exam when the baby's in this position. And so let's go through that checklist. Okay. So we're able to achieve the spine. As I just mentioned, we can see the sagittal spine in this setting. Right away, you're able to get those views. Okay. You're able to get your post fossa. We're able to see the posterior fossa. We can measure out cerebellum, cisterna magna, the lateral ventricle, the nuchal fold, as well as the corpus callosum. We'll talk more about the corpus callosum coming up. We're able to get our measurements. You should be able to do all of your measurements from this view, just in this position. We should be able to do the placenta and the cord insertion from this view as well. It shouldn't interfere without getting it. And then you can achieve all of your sagittal heart views. You should be able to get an aortic arch, ductal arch, IVC, SVC, your ductus venosus, as well as your renal arteries. Okay, so by the time you image all of these structures here, most likely the fetus would have moved around and you can now achieve face and so forth. But this is half of your exam. Half of your exam can be achieved in this position here of the fetus. Okay. All right. So before we get into doing, especially heart situs and so forth, you want to determine a proper fetal lie, whether the fetus is in a longitudinal lie. So that's when the maternal and fetal spines are parallel. So that's in breech or cephalic. You want to determine oblique position, if that's the case, as well as if the fetus is in a transverse lie. Okay, so that's when the maternal and fetal spines are perpendicular. Okay, and this is important for your fetal situs, very important. Now, with your situs, you want to rely on where is your aorta and your IVC. Those are more reliable indicators rather than your stomach location. Okay. So this definitely, so we want to know that definitely your aorta should be on the left side, okay, so closer to the stomach, as well as on the same side as the heart apex. Right? Your IVC is standardly on the right side. Okay. Now for cases of right aortic arch, the location of the abdominal aorta will confirm that suspicion. And I have an example of that. Let's take a look. Okay, so on your right side, guys, your right side is normal. Okay, so this is the left side, this is the right. Your aorta is on the same side as the heart apex. Okay, so that confirms that there is a left-sided aorta. But in the abnormal setting, notice the aorta is to the right of the spine. Heart apex is here, Here's your aorta. So then that should raise suspicion that there is a right aortic arch, which it was. Here's the 3-vessel trachea view of that same fetus. And indeed, it was a right-sided aortic arch present. Okay. All right, so let's move on. Now, I won't spend too much on situs. Situs, I feel like it's its own lesson for another day. But just to go over the details of determining situs, it's going to be stomach and heart apex location. So with your stomach is going to, the fetus stomach is going to be either in the 3 o'clock position or 9 o'clock position. And the heart apex, it's going to be either in a 5 o'clock or 7 o'clock position, okay? I'm more familiar with using the clock method and determining situs. I feel like this slide on the side is very helpful because you can see the position of the fetus. Here's the transducer, but the position of the fetus as well as the location of the heart apex and the spine location, okay? So just to briefly discuss, in the vertex setting, as well as in the transverse head right setting, the stomachs will be on the 3 o'clock position, and the heart will be positioned at 5, which you can see in those examples. You see, heart apex at 5, vertex, and same for transverse head right, which you can see here. Okay. Now, in the setting of breech and transverse head left, your stomachs will be positioned at 9, and the heart apex will be at 7. And you can see that in this demonstration here and here. Okay. All right. So your spine is your 12 o'clock position, and it's just going around the clock method. This I find is easier to understand. Okay. All right. So let's move on. So here's a sweep. This is a typical sweep, a situs sweep that I do usually prior to taking my heart views. I'm sweeping through the fetus, I'm determining the position, and then I'm confirming that the stomach and the heart apex positions are the same with the fetus, which you can see here. Baby is in a breech position, and you see the stomach is at 9, heart apex was at 7. Okay. All right, so let's go on. It's going to show it one more time. Let's look at that one more time, and then we'll move forward. You see bladder. Here's your stomach at 9. Apex is at 7. All right. So let's go here. All right. So now we're going to get into breaking down our different views that we need to achieve. We're going to start at the top of the baby, which is the profile view. So this is awesome. I love this profile view because you're able to see the nasal bone. You see the nose structure. You can see the face structures. The chin appears good. And we're able to measure the length of the nasal bone. I include a chart here so you can see what's considered normal nasal bone length determined by the fetus age. Okay. And then we're also able to see, if you notice, the corpus callosum. So that's that structure in the brain, in the midline, as well as the CSP. You can achieve all of this in your profile view. Here is the corpus again in this setting here. Okay, so let's take a closer look at the corpus actually. So we actually just started doing these structures routinely with our level 2s because we had a few fetuses born that were missing these structures and they were severely delayed and so forth. So this is a standard view that we achieve on all of our level 2s here on out, okay? So with these two views here, if the CSP is absent, then you should suspect usually that there is an absence of the corpus callosum, Okay, because they're developed together, so they're like a team. I always say they're teammates. So if one's not there, the other is usually not there. So if there is absence of the CSP, then we suspect that there is an absence of the corpus as well. Okay. Now, in cases where the CSP may appear enlarged, the normal value for the CSP is less than 9 millimeters. Okay. And CSP appears as this block rectangle shape right below the CC. Okay. So you just want to measure right here if it appears enlarged. Usually we do not routinely measure if it appears normal, which is it is in this setting here. Okay. But very important structures, and you can achieve this from your profile view. Okay, it's fairly easy to achieve this. Okay. All right, so now we're just going to review our normal measurements, starting with the BPD and head circumference. Our normal landmarks for the BPD and head circumference is the CSP. Okay, so we're already routinely looking at it when we're doing our BPD measurements. So the CSP is a normal landmark, as well as the midline falx and the thalami. Okay, you want to have a more oval shape, you see, so you can get proper measurement. And here's an example of that I did. Okay. All right, so we have to do our standard post-fossa views. So that includes the cerebellum, the cisterna magna, which you see here, and the nuchal fold. I think we all know how to properly measure those. But here you can see from outer to outer, cerebellum, inner, cisterna magna, and then outer to inner for the nuchal fold. Okay, here is a view of the CSP, which you can see there. So that rectangular shape, as well as the lateral ventricles. Now remember, to help you remember the normal measurement for the CSP, think of the lateral ventricles, which is 2, also less than 10 millimeters. Upper limit of normal for CSP is 9, but 10 is the cutoff usually for norm. So they're the same. CSP and lateral ventricles are the same. Okay, so less than 10 millimeters. All right, so now we're going to look at a sweep from our orbits. Let's look at that. So with your orbits, if you sweep down, you'll see your orbits, the islands. You'll sweep right into the palate of the mouth, nose and lips, which you can see here in the clip, as well as the mandible. All of that can be achieved in that orbital shot, just sweeping straight down from the top of the head. We're going to look at that again. So here you can see the orbits. I'm sweeping through. I can even see, let's play it one more time. So here's the ventricles, post fossa. Then we'll sweep back, nose and lips. See that? It's going to go straight to the orbit shot. You see the uvula, equal sign, mandible, and palate. All that's achieved in that one sweep. That's less than 30 seconds. I usually sweep first, and then I take my images right after. Okay. All right, and here are those images again. So you see the palate. Palate is more like created like a U shape, you see, compared to the mandible, which is more at a V position. And then you have the nose and lips here in the center. Okay. All right, so we're getting down to the middle part. So now we're looking at the fetal chest, which you can see the lungs. It's nice and symmetrical. The heart sits in the center. Okay, so let's break this down. Here's a typical sweep through the stomach. You see correct situs and the heart. We're going to sweep from the 4-chamber LVOT. Look at that. See 4-chamber. Oh, it's a short clip. It's only 12 seconds. But here you can see 4-chamber, LVOT, RVOT, and then your 3-vessel trachea view. I have more clips coming up so you can see the thymus gland and so forth. So let's take a look here. Okay, so before we look at those other clips, let's go over a few settings that's routinely used for the heart settings. This is just